Hi, November here at Kooringal Vets is Parvo and Vaccination Awareness Month. So, lots of people have heard a butt ton about Parvo, not only on the news but also on the radio and various social medias. The reason for that is that we have had an absolute outbreak of Parvo virus here in Wagga over the last few weeks. And that's really important to us because it's actually occurred a lot earlier in the season than what we usually expect. We usually expect Parvo cases in late November to December, but we're getting cases from early October. So, Parvo virus, as its name suggests, is a virus that is highly contagious for young dogs. Essentially, parvovirus attacks rapidly dividing cells, which is why not only it affects young animals, but it attacks specifically the gastrointestinal lining and cardiac tissue. Now, what that means is that dogs that develop parvovirus have profuse diarrhea and vomiting as well, which is often full of blood. What this means is that dogs with parvovirus dehydrate very, very quickly and can die from dehydration within 24 hours of showing symptoms. Now, the treatment for Parvo is very intensive. It involves intravenous fluid therapy, antibiotics, and gut intestinal support therapies. Now, because the treatment is very intensive and unfortunately mortality is very high, the easiest, simplest, cheapest way to prevent your dog from getting parvovirus is to vaccinate. So vaccines have absolutely revolutionised how we control disease, but a lot of people don't actually understand what a vaccine does. Now, a vaccine contains a genetically modified version of the disease that we are trying to prevent. We call this an antigen. Now, when we give a vaccine, the antigens are recognised by a specific type of blood cell called a lymphocyte, of which there are two types. This becomes important later when we're determining our short-term, weeks, months, immunity versus our long-term, year-long immunities. Okay, so when a vaccine is given, the antigen is swallowed up by the T lymphocytes. They swallow this up similar to the way Pac-Man used to do in those old video games. Once the T cells have eaten the antigen, they destroy it using various enzymes and chemicals. This is what causes our short-term immunity. The other thing that the T cells do is that they then use part of that antigen and present it to the second type of lymphocyte, our B cells, to produce our long-term immunity. The presentation of the antigen to the B cells is similar to the way that our hand would present a key to a lock. Our hand being the T cell, the key being the antigen, and the lock being our B cells. When this key is presented into its lock, the B cells then choose to produce antibodies. What these antibodies then do is they can circulate our system for years and decades, and anytime that antigen is back into our bloodstream, we get that immediate immune response because our bodies has seen that antigen before. What this means is that ultimately a long-term protection can be produced to that specific disease. So with regards to the vaccination protocols that we do for dogs and cats, dogs usually receive what we call a C5 vaccination, which covers Parvo, distemper, infectious hepatitis, and 2 parts of kennel cough. Cats receive an F4 containing different diseases. Now, bring yourselves on down into Kooringal Vets and we can discuss what vaccine protocol is best suited to your cat or dog, or if you wanted to, any other animals that you happen to have as well.